What about cognitive decline?
Hmm.
Let's bring them in that realm.
Yeah, that's good. It's similar story, again, when the brain is, DHA is the most abundant polyunsaturated fatty acid in the brain, next to arachidonic acid, with the next one down. So it's a major component of neurons and synapses and different structures in the brain. So DHA is important, no question. Um, and so people have always thought, well, maybe we ought to, well, and just to follow the logic, we look at autopsy specimens on people who died of Alzheimer's disease, and the DHA content is lower than in people who died of the same age of non dementia-based diseases. And we know that red blood cell levels of DHA being low predict a increased risk for dementia from a couple of Framingham studies. And now we have just working on a manuscript today, study that took data from 19 different cohorts, pooled fatty acid levels and looked at risk for dementia and Alzheimer's disease. And it's the same story. The higher the levels of EPA and DHA, not just DHA, actually EPA too, which may be an anti-inflammatory component, because EPA per se is not found in the actual flesh of the brain. But it does circulate through the brain, through the capillaries, so it's may be playing a role. In any event, higher levels of EPA and DHA linked with about 10 to 12% lower risk of developing dementia or Alzheimer's disease over time. So the story is coherent. It makes sense. I'll just jump back. Having said that, we just published another study looking at blood linoleic acid levels, omega-6, and dementia. This was done in the UK Biobank, which is a cohort of some 400,000 people in the UK that were screened, 15 years ago. They were between 40 and 70 years of age, general population screen, basically. And they've been followed now. We have blood or plasma linoleic acid levels on these people, and we looked at the question, is there a relationship between linoleic acid levels and risk for dementia? And same story, higher levels of linoleic acid, lower risk for dementia. People who had the highest risk for dementia had the lowest levels of linoleic acid. So it's the same as kind of the heart disease studies, same story as total mortality, high linoleic, good. High omega-3, good. I mean, I kind of see omega-6 and omega-3 as, or linoleic acid, EPA, and DHA, to be specific, as partners in good health. They're both good. And there's no reason to think that one of them has to be good and the other one has to be bad.
Any connection between that trifecta and mood disorders?
Yeah, some. Again, the work we've done in this area and anxiety and depression, we have seen the relationship others have seen, that low levels of the omega-3s in the blood are associated with higher risk for depression and anxiety. And randomized trials. This is one of the interesting things. This is depression. I guess we'll call that a mood disorder. People we've done lots of trials giving omega-3 supplements to depressed people to see if you can fix their symptoms, over the years. And when we look back at those studies and ask the question, was there a relationship between the EPA to DHA ratio in the supplement and the effectiveness of the product? It turns out that it's the products that are richer in EPA, like it's 60-40 EPA to DHA or 70-30, something like that, as opposed to the opposite situation where DHA is rich. It's the EPA-rich products that seem to work, but not the DHA-rich ones, which was, again, counterintuitive to the idea that DHA is in the brain, so you ought to give DHA. Well, it's just not always that simple. There may be something. That may be the one case where we have some pretty good evidence that an EPA-rich product is better for depression than a DHA-rich one, but we don't really have that data for heart disease.
When it comes to the anti-inflammatory benefits of omega-3s, I could see that being a huge benefit when it comes to chronic inflammation, but acute inflammation is the body's natural response to healing. So what I'm getting at with this, have you seen anything where somebody taking too many omega-3s or upping their omega-3s and then they're blunting that natural response?
That's a great question. I have not been asked that before. And I'm thinking, no, short answer, no, I haven't seen that. But I'm trying to think of how you'd study that. I guess you could look at the rate of wound healing in a way after a uniform wound in an animal. You could, I suppose it can be done in humans too, but if you want to get at the acute inflammatory response, the omega-3s probably do blunt that, but do they blunt it to the point where it's pathological? Haven't seen any evidence to that effect. Again, if you look at just to back up from the inflammation thing, but when you think about omega-3s in general, you think of the Japanese who have this chronic lifetime. I mean, from -9 months of age till through their whole life, they have a lot of omega-3, a lot more than most of us. And if there were really adverse effects of it at that level, you would think it would show up. But the Japanese live about 4.5 years longer on average than Americans do. I like to attribute that to omega-3. I don't think I can do that, honestly, because there's a lot of other factors. But if you think about the Japanese culture in general, they smoke more than we do. They have more high blood pressure than we do. They have more stress than we do. That's in the popular mindset. And yet, they live 4 years longer. So how do they do that? And if there was if high omega-3s were in some way detrimental to an inflammatory or immune response, you would think it would manifest somewhere in a culture like that. Anyway, I've not really seen any evidence that a acute response to inflammation from an injury is blunted by having omega-3.
Any other major benefits of omega-3s we haven't talked about?
Well, when you can't feel an omega-3 deficiency. It's kind of like you can't feel a high cholesterol. You can't really feel a high blood glucose to a point. So when we give people omega-3s for high triglycerides, for example, give them for some other reason, it's not uncommon to hear that people will say anecdotally that, oh, my knees don't hurt so much anymore, or my shoulder feels better, or, there's a joint benefit to the taking the omega-3s, and that would probably be part of the anti-inflammatory component of it. So yes, for joint health, I think there's some reasonably good evidence that omega-3s are helpful. For eye health, we're seeing higher levels of omega-3 associated with lower risk for age-related macular degeneration in the eye. And there's some controversial evidence about omega-3 in dry eye disease, whether it's effective or not at reducing dry eye. But the eye is, of course, that's an inflammatory condition. So that's an area where we think we might see some benefit. There's some benefit been shown in glaucoma, sticking around the eye here, and certainly in the diabetic retinopathy that occurs in the retina. People who have diabetes, there's been less damage done to the retina in people with the higher omega-3 levels. Although, again, some of these things have not been subjected to randomized trials. A lot of this is observational associations, but that makes sense from an anti-inflammatory point of view. Other conditions, those are really the big ones. I mean, again, we haven't talked much about diabetes, and the observational epidemiology studies suggest higher omega-3 associated with lower risk for diabetes. But does that mean you can take omega-3 and, correct your blood sugar? Well, probably not. So there's, to the extent that diabetes is also an inflammatory disease, aren't they all, right? It makes sense that high omega-3 would be helpful. And unfortunately, high linoleic acid is also helpful in preventing diabetes. So there's that thing again.
Anything other than the inflammation you can connect from omega-3s to diabetes?
Not directly. I mean, the omega-3s, as I said, they live in cell membranes. And by virtue of being in a cell membrane, they change the physical properties of membranes. And of course, every cell is a membrane, and every membrane is terribly important, and every membrane is unique. Every cell type has a unique membrane. And the one metaphor I kind of use to help people understand what omega-3s do in membranes is to picture membranes having doors, an in-door and an exit door. And these are protein channels for us in the sciences that are opened and closed appropriately when they're needed to be. When you need to get a signal into the cell to do something, you will need to get food in the cell. There's a door that has to come open to bring the stuff in the cell. And if you think about those doors, think about the omega-3s being oils and lubricating those doors, the hinges on those doors, so that they open and close more appropriately. If you can't get the right nutrients in, the right signaling molecules into the cell at the appropriate time, the cell can't respond properly. It's not going to be healthy. If you can't take the trash out, which you need to do in a cell, you need to get rid of the trash, just like your house. There's a door for that. And if that hinge is stiff, you're going to keep the trash inside. That's not good for the cell. So the omega-3s really help optimize cell membrane function. It's a little bit of hand waving there, but that's kind of the general idea, that they do help at the membrane level. And that's not necessarily an inflammation-related thing. That's part of how they regulate the inflammatory response, is how they open and close these doors. But it basically is, why do cells just work better? Why do they live better? They don't have to. Cells live longer. I mean, we look at the rate of telomere attrition or shrinking of the telomeres. We know that people who have the highest omega-3 levels have the slowest rate of loss of telomeres. So it means their cells are turning over less fast. They're living longer, which manifests in a longer lifespan for the whole organism. So.
Since you made it to the end of this clip, I know you're going to love the full episode. Click here to watch. I'll see you over there.
The omega-3 story really started in the 70s with cardiovascular disease. The omega-3s were really shown to do a variety of things. One is they lower levels of one of the blood fats called triglycerides, and lowering levels of that is